Come in.
Hello, how are you today?
I'm fine, thank you.
Oh, great to hear. My name's Sean. I'm your nursing assistant. Do you mind if I check your ID band?
I don't mind at all.
Oh, hi, Miss Pat.
Hello.
Miss Pat, I'm here to help you get cleaned up. Would that be okay with you?
That'd be great.
All right, if you don't mind, I'm going to go wash my hands. Your call bell's right here, and I'll be right back, okay?
Okay.
All right. On test day, I'm going to go to the sink and wash my hands using proper techniques. See the earlier video to do that properly. I'll return, place my gloves on, and gather my supplies. Miss Pat, do you mind if I shut your door and curtain for privacy?
No, I'd appreciate that.
Okay, great, great. That way, it'll just protect you in case somebody decides to come in the room.
Okay.
All right, so we're going to close the door and the curtain for privacy since we're really going to have the resident exposed. All right, there we go. And let's go ahead and gather our supplies. Now for this procedure, we're going to need 2 towels. You don't ever want to shake your linen in the air because it will throw debris up in the air. You're just going to methodically unfold it like so. All right, I'm going to grab my second towel. I'm going to grab at least 6 washcloths. If you grab more, it's okay. Or if you drop one, you can always announce to the nurse aid evaluator correction and continue on. And I'm going to grab 2 incontinence pads. Let's go ahead. Do you mind, Miss Pat, do you mind if I go in your bedside table?
No, I don't mind.
Okay, it's always good to ask permission because they have a lot of personal belongings in there. And just remember, we're in their home. This is where they live. All right, so I'm going to get some soap and a basin, a wash basin. At this time, I'm going to step over to the sink and fill my wash basin up with some warm water. So I'll be right back. Miss Pat, call me if you need me. I'll just be right here.
Okay.
All right. Miss Pat, do you mind testing this to see if it's a good, comfortable temperature?
That feels good, thank you.
All right, great, great. It's always very important to use indirect care. How you communicate with the patient throughout the process is very important. In fact, it's one of your skills that you know you're going to be evaluated on test day. So really work on verbalizing to the patient what we're doing and really just treat them like they're your mother or father. All right, let's lower your... Miss Pat, do you mind if I lower the head of your bed?
Oh, no, I don't mind. Thank you for asking.
Oh, you're welcome. We're going to be rolling the resident, so it's important to always have them in supine or flat position when we turn them. It's very uncomfortable to turn someone that's sitting up. All right, sir, do you mind if I switch places with you?
Okay.
So I can remove this incontinence pad and place another one on. Miss Pat, we're going to turn you to the side. I'm going to try not to expose you very much. Let me just adjust the linen and we'll get you turned and get this soiled linen from under you, okay?
Okay.
All right. So the nurse aid evaluator will assist you on test day. All right, Miss Pat, on the count of 3, I'm going to help you roll.
Okay.
It's always good to support the hip and under the shoulder and assist the resident to turn. On the count of 3, we're going to turn on your side. 1, 2, and 3. All right, you don't want to get them too close to the edge of the bed. Miss Pat, how are you feeling? Are you comfortable?
I'm fine, thank you.
And you can always bend their legs slightly, and that'll help them stay in the turn position. All right, so I'm going to roll this incontinence pad very tightly. It'll really help you as you try to remove this linen from under the resident. Now these incontinence pads aren't perfectly square. They're actually a little rectangular in shape, and that goes across the resident, okay, the longest portion. So what you want to do, I'm sitting it like this to really demonstrate clearly to you how I do this technique. We at ACT like to put 2 incontinence pads down because you have to leave them ultimately on a dry pad. So this is a nice little technique that'll make it easier for you near the end of the procedure. All right, Miss Pat, how are you doing?
I'm doing good, thank you.
Okay, so what I'm going to do is I'm going to tuck this under this dirty incontinence pad. What's neat is it's staying clean because all the wetness is inside. And we're going to roll Miss Pat back or assist her to turn back this way. All right, there's a large bump under you, Miss Pat.
Okay.
All right, I'm going to assist you to turn at the count of 3, okay? All right, 1, 2, and 3. All right. Again, keeping exposure to a minimum. And I'm going to assist her to adjust her pillow. All right, Miss Pat. All right. Now, you could either choose to walk to the other side of the bed, or you can remove the incontinence pad from over here. Since we did such a good job turning her and rolling that incontinence pad up, I'm going to remove it from this side. All right, Miss Pat, I'm just going to get this bump from under you, okay?
Okay.
So you just reach over. I have her just slightly turned, and you can roll that other pad out. Now the dirty stuff is rolled in on itself, okay? So there's minimal exposure to the environment. All right, Miss Pat, how are you doing?
I'm fine, thank you.
Okay, let me get this put in the dirty linen and we'll get everything going. All right, Miss Pat. Hang in there and we'll get this done pretty quick, okay? Now I'm going to place this other towel over Miss Pat to help minimize the exposure. Miss Pat will be just a second. I'm going to roll this linen down, okay?
Okay.
So I'm just going to move this out from under her feet, and you can see how I'm being very careful not to expose her. It's cold and a little bit embarrassing to be exposed to people you don't know. So I've got this pretty much fan folded down to her knees, and this is covered up. Now what will happen is when I'm ready to clean her perineal area, I can just fold this back and just the minimal amount of her body is exposed, okay? Let me go ahead and adjust this gown underneath as well. It's easy to manipulate the linen without exposing the resident. All right, Miss Pat, you doing okay?
Yes, thank you.
All right, so let's go ahead and get this done. We'll be done in just a minute. All right, so I have my soap and my rags. I'm going to go ahead and wet my washcloth. I'm going to wring it out real good. You don't want to get too aggressive with the amount of soap you use. You don't want a real sloppy wet washcloth. We're going to do her suprapubic area, the area above her pubis or her perineal area first, okay? So we're going to use just a small amount of soap. Miss Pat, is it okay if I use a little bit of soap?
Sure.
Okay. All right. I always lay my soap down because when it's standing up, it's real super easy to fall off. All right, Miss Pat, I'm going to expose you for just 1 minute.
Okay.
Hang in there.
All right.
I'll try to make this quick.
Okay.
Okay. All right. So the technique you're going to use the back of each mitt. Okay, I'm going to go down 1, 2, 3, 4, 5, and you can get down each side of the groin area, okay? Now I'm going to change this out and use a different wash rag before I go to her vaginal area. All my dirty linen is separated right here with this basin. I have a dirty side and a clean side, and now I'm going to go ahead and rinse her. Now I'm going to work expeditiously because what I don't want to happen is her to be exposed for a long period of time. All right, Miss Pat, here we go. Now this is a rinse, okay? All right. And let's go ahead and dry her. And it's important that you don't really have any hard seams when you do this. It's all soft seams. And we're going to dry her the same way. Now you see what's happened to me there? So what we can do, one way we can adjust that so that her gown is not pulled in, we can just kind of tuck it under, okay? Now let's go ahead and wash her vaginal area. All right. Now, usually I like to use my right hand. I'm right-handed, but I'm on this side of the bed so you can see clearly what I'm doing. And I'll show you, once you make your mitten, you're going to put a little bit of soap. You're going to soap up both sides of your mitten. And you're going to use a technique to spread the labia with your hand on top. You're going to hold open the labia, and you're going to use one finger inside of your mitten to go right down the center from the top to the bottom, or the cleanest to the dirtiest. The rectal area is very dirty, so we want to make sure we we don't drag anything from that area up to the clean areas. Okay, and then a separate finger for the left labia and another finger for the right labia. Okay, so we've washed that. Now let's go ahead and rinse it. We're going to rinse it using the same technique. You don't want to ever put soap directly into your rinse water, and this is why. You want to apply it directly to the washcloth. So we're going to make another mitten again, and we're going to dry simply using the same methods. Okay, I'm going to use my fingers to spread the labia. One finger down the center, one finger down the left labia, one finger down the right labia. And let's go ahead and dry it using the same technique. I'm almost done, Miss Pat.
Okay.
Are you doing all right?
I'm fine, thank you.
Okay, I'm sorry, I'm trying to hurry.
That's okay.
All right, Miss Pat, here we go. Drying the same way, using the hand to spread the labia, one finger down the center, clean to dirty, one finger down the left labia, and one finger down the right labia, clean to dirty, okay? It's the drying rag, so we're okay there. All right, Miss Pat, let's go ahead and get this gown back down. So she is clean, her front side is clean. Now what we really need to do is clean her back side, okay? All right, let's get you covered up as much as we can, Miss Pat, and get you warm, okay?
Okay.
At least a little bit better. And we'll get you turned and get your backside clean. I'm done with this, so I can really put that in the linen hamper. And let me just go ahead and reposition her where she is feels a little bit more normal. All right, Miss Pat, so what I'm going to do is I'm going to turn you on your right side, or assist you to turn, and we're going to get your backside cleaned, okay? And we'll be done.
Okay.
All right, Miss Pat. Let me just adjust these linens so I have minimal exposure again. All right. All right, on the count of three, we're going to turn, okay?
Okay.
1, 2, and 3. All right, I'm going to bend her leg slightly. And Miss Pat, is your pillow comfortable?
Yes, it's fine, thank you.
Okay. Now she's not too close to the bed. She's a safe distance, and I can go ahead and work on this backside, okay?
Okay.
All right. All right, and it's the same process. Now we're just going to clean the perineal area, the rectal area, the same way. Again, I've got a nice warm wash rag here, and I'm going to form a mitten and apply soap. Now what's really neat, because of the work we did earlier, we have an extra pad here, so when we get done, all we have to do is roll the wet one we've been working on out, and then we have a nice clean dry one left. Again, I'm going to use my fingers to spread the buttocks, and I'm going to clean from clean to dirty, so from the rectum back towards the rear. Okay, one finger down the middle, a separate finger on the left, and a separate finger on the right. That's the wash rag. Okay. All right, Miss Pat, we are almost done.
Okay.
And so now we're going to rinse the same way, using the same exact technique. I have no hard seams. All right, expose the area, finger down the middle, finger down the left, and a finger down the right. And now I can really work expeditiously and get this done for her, because I know it's really an odd feeling to have to depend on someone for this. But that's what we do. Big hearts make great CNAs. All right, so here we go. We're going to clean one down the middle, dry one on the left, and one finger on the right. A separate finger, 1, 2, 3 for each stroke. All right, Miss Pat, I'm going to get this incontinence pad out from under you, and we're all done. Okay?
Okay.
All right, so on the count of 3, we're going to roll over a bump. 1, 2, and 3. All right. Now, I'm going to stay on this side so you guys can see how I remove this from over here, okay? Normally, I'd probably walk to the other side, but it'd be very difficult for you to see. All right, Miss Pat, I'm going to assist you to turn. Just roll up a little slightly on your hip. We're going to remove this one. And you want to make sure you don't have any shear, any wrinkles, and it looks good. It doesn't look like we have any of that, because we could cause a resident's skin to break down, and we don't want to do that. All right, Miss Pat, are you feeling okay?
Yeah, I feel good. Thank you very much.
Oh, you're welcome. Can I adjust your pillow for you?
Please do.
All right. All right, Miss Pat, do you mind if I raise the head of your bed where you're comfortable?
That would be nice. Thank you.
Oh, you're welcome. I know it's not always comfortable laying exactly flat. Well, tell me when you feel good.
Okay.
Some of these electric beds move a little slow. That's okay. It's really good not to have really quick, rapid movements anyway with ill or elderly people.
That's good.
All right. And now I'm going to just verify my bed's in its lowest position, and it looks good, because if the resident tries to get up and we're not here and they have a long drop, they could break a leg or something, really hurt themselves. So the bed is in its lowest position, and I'm going to make sure she has her call bell. You'll always want to take care of the resident before you worry about anything else. So, Miss Pat, how are you feeling?
I feel great.
Do you need anything else?
No, thank you very much.
Oh, you're welcome. Let me clean your room up, and I'll be right back. If you need me, you just give me a call, okay?
I will.
All right. So, you're going to place everything back where you got it. I'm going to throw this in the linen hamper. Miss Pat, do you mind if I go back in your dresser right here?
Oh, no, I don't mind.
Okay, thank you.
Okay.
All right. Now I would go back to the restroom or to the sink, and I would dump all the contents of this basin in the toilet, okay? I would rinse from the outside in, or cleanest to dirtiest, and I'd dry it from the outside in, from cleanest to dirtiest. So let me go ahead and step over here and do that now. Okay, now we're going to demonstrate how to take care of a wash basin when you're done with its use. Okay, the first thing I'm going to do, none of the contents of the wash basin ever go into the sink. So I'm going to use a barrier and raise the toilet seat of this bedside commode. Now that I've touched that bedside commode with it, I'm not going to use it as a barrier for anything. I'm going to carefully dump my water in there. Okay, I'm going to get this barrier and turn on my water. Now, it's very difficult to rinse this big basin in this little sink without touching it, so I'm going to use a napkin to help rinse it. Again, we're going to rinse from outside in, our cleanest point to dirtiest point, okay? So let's do that now. I'm going to really saturate my rag. Do your best not to touch the sink, but it's really difficult. Okay, I'm not going to make a career out of being down there. Alright, I'm just going to use this to swish some water around. Again, I'm going to dump it into the bedside commode, not the sink. I'm done with the water, so I'll turn that off. And let me go ahead and dry this. Again, I'm going to dry from the outside in, or cleanest point to dirtiest point. In the medical field, it's a good practice to always do things from the cleanest to the dirtiest. If you're going to touch something clean, do it first, okay? You don't want to drag anything dirty onto something clean, okay? I'm going to finish cleaning this inside point, this innermost point. I'm pretty happy with that. I want to make sure that I close this toilet lid, and now that I've touched this toilet lid, I'm not going to use this barrier any longer. Now I'm going to take a barrier back to open the door of the bedside dresser or table and place this bedpan back where I got it, or this wash basin back where I got it. Alright, let's do that now. Alright, you're going to come back to the room and place this exactly where you found it. Miss Pat, can I go on your table?
Yes, sure.
Alright. You're going to put that back exactly where you found it and finish cleaning up the room. And I'm going to go ahead and open up your door, Miss Pat, if that's okay with you.
Yes, that's fine.
Alright. Alright, let's open up her curtain and door so her room will be back to normal. Now, one thing we strongly encourage here at Advanced Clinical Training is to do a post-procedure check, evaluation. So I'm going to stop and take this opportunity to look around the room. I see everything is just how I left it, the bed, or how I found it. The bed is in its lowest position. Miss Pat's comfortable. She has her call bell. All right, Miss Pat, do you need anything else before I'm done?
No, I'm fine, thanks.
Okay, at this time I'm going to remove my gloves using proper technique. You're going to grasp in the palm and pull down, and then you're going to use 1 or 2 fingers and roll them over the top of each other and let them fall into the garbage. All right, Miss Pat, I'm going to wash my hands. I'll be right back, okay?
Okay.
All right, at this time, I'm going to announce to the instructor that I'm washing my hands using proper technique. I'm going to return and announce to NAE, end of skill.